Complaints are serious matter and can affect our health as a hospital manager and also the doctors. Complaints are bound to happen within the medical field. This is a fact. One study found that 95% of doctors as well as hospital manager experience stress during the complaint process, and most stress occurred on receiving the complaints from the patient. Assalamualaikum. Hello and a very good morning to ladies and gentlemen, as well as my respected lecturer, Madam Rohana binti Matsum. My name is Ahmad Faris bin Ahmad Farouk. Today, I am going to talk about me as a hospital manager, manage patient's complaint. Without further ado, I am going to start my presentation now. First thing first, why does patients complain? Patients generally complain because something has gone wrong. They may be dissatisfied with their experience. They may seek information that is not forthcoming. They may be unhappy with the result of care, or it may due to long wait time. Hence, me as a hospital manager, I have to train my staff, especially the front desk, who is on the front lines, to diffuse those difficult situations and promote peace in every practice. According to the New South Wales Healthcare Complaints Commission HCCC, analysis of the data indicates that 51% of the complaints related to treatment, 15% of the complaint related to communication, and 14% were due to professional conduct. So here, I am going to provide and tell you guys what steps can be taken to handle and manage patient complaints. First, listen to them attentively. As simple as it may sound, this is the first and the most important step when dealing with an unhappy patient. Listen attentively until your patient finish speaking before you interject anything into the conversation. Be sure that you give them your undivided attention. Keep your eye contact and truly hear and listen what they have to say. Don't argue or pass blame, and be sure to control your emotions. Second, make sure you fully understand what the complaint is about, who it is about, and what the patient wants in making the complaint. Third, repeat and speak cautiously. Summarize what they have said to you in a calm and relaxed tone so that they know you were listening to them. Remember that your ultimate goal is service recovery. Fourth, acknowledge their feelings and show empathy. Keep in mind that a person is a patient. He or she may not feel well or just receive an unfortunate diagnosis. So, put yourself in the patient's shoes and let him or her know that you understand their frustrations and care about it. Empathy is key when it comes to successfully handling patient complaints. Fifth, ask questions. Get as much information as possible. This will best help you and your staff. This will help this will best help you and your staff to figure out on how to handle the complaint and to avoid any issues that could occur or that could arise in the future. 6. Explain and take action. Let the patient know that you are taking the complaint seriously and give them a solutions. Explain to them it will be reviewed and discussed among the management, and inform to them that you will follow up with them after the grievance and complaints has been thoroughly investigated. 7th, or the last one, apologize and thank them. Always apologize and thank patients for making the time to speak with you and bringing the matter to your attention. Ensure they understand that their satisfaction and is your number one priority. Next, I am going to tell you guys the action recommendations to manage patients' complaint. First, design a process to address and capture all complaints by the patient. Second, educate all physicians and staff on complaint processes. Third, train all staff to listen effectively and manage patient and family expectations. Fourth, use dedicated staff to solve a small problems before they escalate. Fifth, where appropriate, set a meeting to discuss the set a meeting to discuss the patient's concerns. Suggest an interpreter if language is a barrier. Allow a plenty of time and find a quiet, private room for the conversation with the patients. 6. Provide information. Most people who complain wish to obtain information on what happened and what it means for them. 7th, or the last one, consider the factors that led to the complaint. Are there changes that can be made to prevent a recurrence? If so, tell the patient, as they will wish to see that you are taking the complaint seriously and that it will make a difference. To conclude, patient complaints can be uncomfortable and frustrating, but try to stay positive. View complaints as an opportunity to learn and build upon that to provide an amazing office experience. Complaints are part of working in a medical field and should be expected. How you handle them and learn from them is what will set you apart from the competition. Moreover, monitoring and reviewing complaints should be part of the practice. Information about near misses, adverse events, and complaints provides an opportunity to improve the standard of service and care. Again, this is what hospital management is all about. And with that, thank you.